The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, cosmetic surgery after massive weight loss. With us, we have Dr. Frank Stile, board-certified plastic surgeon. They call him Las Vegas's hottest plastic surgeon because of the results he's getting from his patients. Dr. Stile, welcome to the program.
Hey, Randy. Glad to be
Always
back.
a pleasure to have you on the program.
Always glad to be here.
Now, before we get into today's topic, for those that don't know who you are, about your practice, tell us about it.
Well, I have a cosmetic surgery practice in Las Vegas. It's one of the busiest practices there. We do everything from facial plastic surgery, cosmetic surgery of the breast, including enlargement, lifts and reductions, and body contouring procedures, including tummy tucks, liposuction, and now my practice has expanded to include services and procedures that cater to the massive weight loss patient. This is a unique population that requires special attention. Their surgery is a little bit different than the average cosmetic surgery patient.
That's a very popular procedure nationwide, these weight loss surgeries.
It's getting more and more popular as the number of patients who have had surgical procedures to address their weight issues like gastric bypasses and gastric banding. There are a new set of problems and challenges that these patients face after having these procedures. They basically have traded one type of deformity for another. They've struggled with weight issues for most of their lives. They've taken the chance, both an emotional investment, a financial investment, and in some cases a surgical risk to have a procedure to lose all this weight. And once they've achieved that ideal weight, what they realize is that they're left with a new set of challenges and issues that the skin...
I mean, just a dramatically... just loose skin all over their body. I mean,
right.
You showed me some of these pictures. We're going to get to those photos in a
The skin
moment.
issues aren't only a cosmetic issue for these patients, they're a functional issue as well. It interferes with their quality of life to some degree. And
now I have a lot of questions about this, but you brought some photos.
Right.
Let's start there.
This set of pictures here is of a very important patient, and you'll understand why because you're going to meet him.
We're going to meet him, yeah. He's coming up after the break.
But he came to see me after seeing several other plastic surgeons, and he was very frustrated because his quote was, "They just don't get it." And
really?
Yeah. And what he meant to say was, here I am. I've lost all this weight after having this big surgery, and look at me. I'm not happy because I have a new set of problems and challenges that I'm faced with.
The lax skin,
correct.
Okay.
And he brought me a picture of himself, which is really dramatic, of himself before weight loss surgery. Then the next photo he brought was a picture about a year and a half out of himself after having lost all the weight. And it's pretty dramatic. And you say, wow, he looks a lot thinner, but his issues are obvious. All right, he said, this skin interferes.
So he lost 155 pounds.
Right.
So this is what they look like underneath.
Right, and he said, I still don't fit into clothes as appropriately as I could. I can't exercise because I get spasms from the skin and discomfort from the skin moving around, and it interferes with all other parts of my life, including intimacy. It interferes with his self-esteem, etc. And he wanted a plan. He wanted someone that was willing to go down this road with him to help him get to where he wanted to be.
Now, when you see this, by the way, do you get excited? I mean, you're on the consult, you go, boy, he'd be a perfect candidate.
Yeah, I see the end result in some ways, but I also say, hey, here's a person who needs help, and I'm willing to do it if he's willing to take a chance on me with this.
Okay.
And because of my experiences with Jay, that's his name, we decided to sort of put this program together, and we talked about it loosely at first, and then after his surgery and his experience, he was motivated enough to really pursue me on this, and that's why we're here today, to talk about this program that we've put together that's unique, that will service this unique population.
For massive weight loss.
Right. And here's the picture of him after his surgery.
Wow.
And you'll see it's very dramatic.
Looks fabulous.
I mean, he's changed. I've watched him change before my eyes over the course of the last 8 months.
I met him in person yesterday. You'd never think this guy was ever heavy in his life.
That's what's giving me most of my pleasure. It's the response, and it's the effect that I get to appreciate, in these patients' lives.
Now we're going to hear it from him right after. In a few moments, we're going to bring him on stage after the break. You have some women.
Right.
What are we looking at? Wow.
This is a 36-year-old woman who was heavy most of her life, and she had gastric bypass surgery. She lost about 170 pounds. Very pretty woman, very attractive, but didn't feel that way.
So this is after the weight loss.
That's after the weight loss, and you can
unbelievable.
Right.
Is this common?
Very common, but they hide it.
You don't see them. I guess I don't see
they're a lot healthier because they've lost all the weight. However, they don't feel that they're living their life to the fullest because of the skin issues.
Okay.
And it's not only a cosmetic issue, like I said, it is a functional interference in their day-to-day lives. And it's just because of lax and excess skin. And we did both a breast lift and an extended abdominoplasty on her, and the results are dramatic. I talked to this patient about a year after. She emails me from time to time, and was actually kind enough to send me pictures of herself. She's doing modeling, believe it or not.
Yeah. Now that big overhang on the before picture.
Right.
I mean, you cut it out? Is that what you're doing?
Yeah, it's excised as a huge wedge of skin.
So this woman could wear a bathing suit now.
Right.
A two-piece.
She can wear a bathing suit and feel a lot more comfortable and confident about her appearance. This woman was married, and she still is, but states that her relationship with her husband is significantly improved because she feels better about herself.
Do they act differently, by the way? The procedure's done. They have maybe a little bit of a skip in their step.
Well, the clothes change significantly when you see them several months post-operatively. They're not wearing these loose, non-form-fitting outfits, dresses, shirts. They feel better about themselves, and it comes through in their behavior. This next patient here is about 47 years old. She had bypass surgery herself. She lost about 120 pounds. Now, if you had looked at her from the waist down, she has very small legs. But her abdomen and the resultant skin overhang.
So she lost about how much?
120 pounds.
Okay.
And she continued to diet and exercise after her surgery.
That's not going away.
This overhang, this pannus as we call it, is not going to go away with exercise. And after about 2 years of being frustrated by this, she finally said, hey, you know what, I want to do something about it. Can you help me? And
Are they surprised, by the way? Do they go in saying, hey, am I too far gone? Are they ever surprised that you think you can do it?
They're usually angry that they've waited so long.
Really?
Yeah, and they're usually frustrated that they haven't been given any help in finding someone by the physicians who performed the bypass surgery.
Interesting.
Yeah, and it's not because these doctors don't have their best intentions in mind. It's because they just don't know.
It's one thing at a time.
Exactly.
Obviously, you don't want to tell somebody, oh, and in another year you're going to need surgery for the loose skin.
But they need to know that that's something they're going to be looking at.
So doctors watch this show.
Right.
The ones that do these bariatric surgeries. What do you want them to know about what you're doing?
I think that they should incorporate information about these procedures in their evaluations of these patients and in their ongoing relationships with this patient population.
For sure, though.
Right. Say, hey, you know what? If you have this bypass procedure, when you plateau, you will most likely have one skin issue or another that might have to be addressed surgically. And these are the procedures that are available, and these are the doctors that are performing them right now.
This is amazing. Okay, so you see this.
Right.
This is just what, a massive tummy tuck? What are you doing?
This is an extended abdominoplasty, and these are her follow-up pictures. She can obviously fit into clothes a little bit better. Her exercise tolerance has gone up, and she's gone on to lose a little bit of more weight additionally because she can exercise more now and more comfortably.
Okay, now does this give them like a little bit more leverage? Okay, they lose 150, they reach a plateau.
Right.
Now they get the surgery.
Well, if you feel better about yourself, you're going to work harder to maintain it. If you look better and you see a result, you're going to work harder to maintain it. It's logical.
Yeah, okay.
If it doesn't hurt to exercise, you're going to want to do it more. These patients are uncomfortable when they exercise.
That big overhang.
Right? You can't run. Can you imagine this patient running on a treadmill?
Good point.
There are lots of issues.
I mean, do they tell you, okay, I'm able to do so many more things?
Right.
Than I was
Absolutely.
able to do before?
Absolutely.
Okay.
They're happier. They're more motivated. They get better results. They see instant results from this. So why not?
All right. All right. Okay. You have more photos.
Right. I have some
stuff.
pictures of some smaller weight loss patients. Like this one here lost 70 pounds. She had some liposuction and an abdominoplasty as well as a breast augmentation.
Oh boy.
And it's a dramatic change.
So she lost 70 pounds and that little overhang, you call it a what? You call it a pannus?
It can be a pannus, right.
Okay. You just flatten that out.
That skin is excised, and if you look at the flanks, she's had some liposuction as well. And she's also had a breast augmentation to replace some of the fatty tissue that she's lost in her breast. There's a significant component of breast volume is fatty tissue as well as breast gland.
Okay.
This next patient here is another typical weight loss patient who has a obvious deformity as a result of her weight loss and her excess skin that resulted from her weight loss. And this patient here also had an extended abdominoplasty.
Very nice.
This next patient here is in her 30s, and lost a significant amount of weight, and required both a breast lift and an abdominoplasty, as well as some liposuction.
Boy,
She
that,
got
you know,
all of that.
these abs are just cleaned right up. No overhang at all.
And once again, look at the difference in choice of undergarments, the colors, much brighter.
difference.
Right. This patient here had a bypass procedure, lost about 160 pounds. And what she was left with was a significant breast asymmetry, as well as redundant abdominal skin.
This seems like a young patient, very young patient.
Very young. She's in her late 20s.
Late 20s.
Right.
So the abdomen, I mean, there's just no way to get rid of that.
No.
Except for surgery.
Exactly. I mean, you can work, you can do sit-ups and abdominal exercises, and yes, that will strengthen your abdominal wall, but nothing will happen. That skin is going to be there until it's removed surgically. And these are her post-operative pictures.
Wow.
We addressed the breast asymmetry with a lift on one side.
Huge difference.
Gave her implants and did an extended abdominoplasty, and it's night and day.
So tummy tuck, breast lift,
and breast augmentation. Randy, what you have to remember is that these patients have been heavy for most of their lives. They've never gotten to wear the clothes they wanted or participate in the activities that they wanted to because they felt uncomfortable about their appearance. After they have their weight loss surgery, yes, they're healthier, but they're still faced with the same challenges. Once they have some of these cosmetic surgical procedures, which in some ways are reconstructive procedures, if you want to look at it in its purest sense, they're able to do all those things that they wanted to do.
I mean, you can see this gal sitting on the side of a pool, probably showing off her abs.
Finally, and feeling a little bit more comfortable about it. And that's where I get my satisfaction from, hearing things like that from my patients, and I do hear those things.
And these are the kind of things where people say, boy, I should have done this earlier.
Absolutely, absolutely.
Now, we have your patient coming on, so we're kind of crunched for time here, so we have time for a couple more photos.
Okay, this patient here was a 33-year-old female, had a bypass, lost a lot of weight. I show these pictures here because in addition to having her
what a difference.
Her surgeries for her excess skin issues, she also had some cosmetic dentistry done by a friend of ours, Dr. Gulpa.
Dr. Gulpa, yeah.
Right, and this is a picture of her, you know, before she had her weight loss surgery, and this is a picture of her here after her weight loss surgery and her cosmetic surgery.
So what did you do for her?
She
had tummy tuck, lipo,
a tummy tuck, abdominoplasty, breast lift, breast augmentation. I mean,
unrecognizable.
She looks like a star. If you
she does. She looks like some kind of.
Randy, if you have time for one more, I'd really like to show you these. This is really interesting because this is actually a couple, a husband and wife, who were heavy. Both had their gastric bypass procedures at around the same time, lost all their weight, and then they took turns having their cosmetic surgery with me. This is a photo of them before their surgical procedures, either their bypass or their cosmetic surgery procedures, and this is a photo of them both afterwards. And look at the dramatic difference in these pictures. Much happier.
What do they say? I mean, do they thank you? They hug you? What do they say? I mean, because
by far, this is the most grateful patient group that I deal with. You know, the impact is obvious. You know, the quality of life improvements are evident, you know, and it just makes me feel good about what I do and happy that I can do it.
And people are traveling to see you. Is that right?
I get patients from all over the country and some patients from Canada as well.
You know, I get asked all the time, plastic surgeons that don't want to do it, and I told them about you. And so they're going to be sending those patients to you.
Thank you.
Now, we're going to meet your patient in a second. Jay.
Jay
And he lost 155 pounds.
Right.
And tell us about Jay. What are we going to hear from Jay?
Jay was the patient whose photos you saw earlier on in the interview. He's a guy, he's a graphic artist, knocked around from doctor to doctor's office and finally, you know, happened upon me in my practice. And he was frustrated. He said, you know, Dr. Stile, these doctors just don't get it. They don't understand the issues that I face. They don't understand how it feels to be me, or a patient like me that's lost all this weight and now has these new challenges that limit my life. Can you help me? Basically, that was it. Can you help me? And we talked for some time. I got to know him a little bit better. I wanted to make sure that he was realistic and that he was motivated, and he was. We took a chance on each other, and things worked out great. Okay,
we're going to take that break, and when we come back, we'll have him right here. Great. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, you're going to meet a patient that had the surgery, and let's hear what he has to say. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Frank Stile, board-certified plastic surgeon, with his patient, Jay, who lost over 150 pounds and had cosmetic surgery after massive weight loss. Jay, I want to thank you for coming on the show and sharing your story. And so we'll start with how you heard about Dr. Stile.
I heard from Dr. Stile through a friend of mine after I've seen several of the surgeons, and I got a consult, sat down with Dr. Stile, and then I realized that he was actually the doctor I wanted to have my surgery with.
Okay, so on the consult, you came in, what was your problem? In fact, let's take a look at your picture right there. I mean, you were pretty heavy there.
Yeah, I was 360 pounds there. I was heavy all my life. I was almost 11 pounds when I was born, so it's something I've had to deal with my entire life. And now through technology, through gastric bypass, which is what I had, I'm finally at a point where now I can look thin and be normal.
Yeah, you look. I mean, I told you I've seen you in. You showed me your stomach yesterday. I mean, he looks great. I mean, was he an easy patient, typical patient?
He wasn't. I mean, there's nothing easy about it, and there's once again there really is no typical patient, but he had some of the typical issues and challenges that this patient population presents with. Here's a guy lost a lot of weight. 155 pounds to be exact, was thinner, healthier, but had this huge issue with redundant or extra skin, and it was almost hanging down to his upper thighs.
Let's take a look at that.
And here's a picture of that he took himself.
So you reached your goal your whole life, you worked toward this, and now you have this saggy skin. How did it make you feel?
Well, I realized at that point that every time I looked in the mirror, I was still heavy. I couldn't put my shirt in my pants. I still had to pull it out to hide the roll. It was still there when I would try to sit in my tighter seats, whatever. So I lost all the weight. I was doing ab crunches and everything, but it wasn't changing it. The only thing that was going to change this and give me the body I always wanted was to have plastic surgery.
So Dr. Stile, I mean, this overhang, is that common for people that are losing this kind of weight?
Very common, very typical.
There's no way to get rid of that other than surgery?
You can do sit-ups and you can run on a treadmill for a year and that's not going to go
anywhere. So what's in there?
It's
just skin or is it fat
just
and
extra skin and a small amount of residual fat. You know, the amount of fat and amount of skin varies from patient to patient, but the issue is the same.
Okay, so with him, what did you do? I mean, what kind of procedure?
Well, what we did was what I like to call an extended abdominoplasty, and what that basically means is it doesn't go from iliac crest to iliac crest or hip to hip. It goes around, almost meeting in the back.
Oh, really?
So I can get some of that skin out from the lower flanks and give a small degree of lift to the gluteal region as well. We did a little bit of liposuction in the lower back as well, just to give him a finished off contour. But it was one of the larger segments of skin that I've ever resected in my career.
Really? Really? I mean, how much? Showing with your hands.
It was pretty big. I mean, from tip.
Really?
Yeah, pretty much about 3.5 feet. And
what do you do with that skin?
We actually donate the skin to a cancer reconstruction program or burn center where they actually purify the skin and use it for patients either temporarily or permanently who have defects. So none of this goes to waste.
Now you say that you're involved online, I guess networking with other weight loss patients.
I talk to weight loss patients all around the United States and around the world. I also go to support groups locally. And and we all talk about the same issues and have the same problems.
And what are the main issues? Just the laxity of skin after the weight loss?
Yeah, after 2 to 3 years after you have weight loss surgery, you're going to need plastic surgery. It's just a fact that most people have. Women have different issues than men, but it's something that most of us come down to realizing this is something we have to do.
Now, when you were in with the doctor that did the surgery, did he ever tell you, hey, you lose 100 pounds later or 150 pounds, you may have to have some surgery?
No, they never told me that. I found through research online and stuff that a lot of people did. I actually thought I wasn't going to need it. But as I started losing weight quicker and quicker, this little shape wasn't going away. And when I got down to my goal weight, it was still there.
So what about now? How are things different? I mean, now that you got rid of that.
Well, I feel great. I can actually wear clothes now. I can tuck my shirt in. Exercising is a big plus for me now. I can actually go running, and I don't feel my stomach jiggling in my way.
That's a good point. Okay, so you really can't run with this before.
No, and I was actually having muscle spasms because of the overhang of the skin. So now, because that's gone, it's changed my life. I feel better. I think I look better, and it's helped my self-confidence also.
People treat you differently? I mean, you were a big guy, 360 pounds?
360.
I mean, do you notice? I mean, do you feel it that they're treating you differently?
Unfortunately, yes. People do have a little bit of an attitude when someone is larger. They think they're lazy or whatever, and it's not the case. But now that I'm a lot thinner, most people don't realize I was heavy, and they do treat me different.
Okay, Dr. Stile, how soon can, in an ideal situation, can somebody go back to work after this surgery?
You can go back to your, what I like to call activities of daily living, which is taking care of yourself, taking care of your personal errands around your house, and even driving. Or if you have a sedentary job that doesn't require heavy lifting or a lot of activity, 2 to 3 weeks. But back to full activity, usually 4 to 6 weeks, including exercise.
What else can patients expect after the surgery?
They're surprised that they see their results instantly. When they have their bypasses, you know, the changes are slow and happen over the course of 12 to 16 months or 18 months, a year and a half, 2 years. But with the cosmetic surgical procedures, once they wake up, it's gone. You know, he was a different guy, and he was quite amazed to find that it was gone. I mean, the changes were made, and the only thing he had to wait for was for the healing to take place. They have a small amount of discomfort. You know, it's usually managed with oral pain medication, and we follow them closely. You know, we see them many times during the course of their first month in their post-operative period, and then we follow them up for the whole first year. We help them with plugging them into support groups, nutritional and exercise counseling, which we offer the resources for that as well.
Your program is comprehensive? I mean, you put it all together for them?
It is comprehensive. From the moment they walk in the door and express an interest in this type of service, we sit down with them, put together a realistic game plan with realistic goals with respect to time and what their priorities are. We stage the surgical procedures if they need more than one, if it requires more time than we'd like to do at one sitting, and make sure that what we do doesn't really interfere with their jobs and their quality of life outside of the surgery. We take care of them with respect to plugging them into nutritional support, exercise and training after this, and support groups as well. Part of our Jay's experience was so good that he was very passionate. He was very passionate about this, and basically said, "Hey, let's put a program together that can offer all this to people like me."
Is that right? So you want to help? I mean, you want to help others. I mean, that's the reason you came on the show. You said.
Exactly. We created this program for weight loss patients because I want to help them create and end their journey like I did mine. I want them to have the body they always wanted. Actually, like one thing Frank talked to me as soon as the surgery was over is he came in and we were talking about the instant gratification. He said, "What do you think?" And I was looking down going, I can't believe this is my body.
Really?
With weight loss surgery, you're losing 2 to 3 pounds a day. Here, after 4 hours of surgery, it's just gone.
How much weight, by the way, after the surgery did you lose?
It took 12 pounds off me.
12 pounds. So your mission, by the way, is twofold: to get people that are overweight like you to get either lap band or gastric bypass, and then to get the cosmetic surgery afterwards? Or is your mission more toward the people that have this overhang, this huge loose skin?
Well, for the people who never had weight loss surgery who are thinking about it, it's definitely something you should do. And for people who have lost all the weight and they're still not happy with what they look like, it's something you definitely need to do. It was the best money I ever spent.
Really?
Yes.
So you would do it all over again?
Oh, I do it in a heartbeat. And then luckily I met Dr. Stile, who I think is one of the greatest surgeons in the United States. Luckily I lived in the same place he did, and we created this program.
That's very nice. Now, by the way, your loved ones, when they saw you, say some of your family, they haven't seen you.
No, they haven't seen me yet. They've seen pictures, but they haven't seen me in person yet.
Are you excited about that?
I'm very excited.
Okay, what were their reactions, by the way, after this surgery with Dr. Stile? What did people say?
Most people couldn't believe it. And the fact of now I can wear a lot tighter clothes, stuff I've always wanted to wear. I finally look like a normal person. I ask people all the time, do I look normal? Do I look like I was heavy?
You do?
Yeah, I do all the time. And if I show them like a picture like this, they don't believe it's me.
You just blend in now.
I blend in. That's kind of what I want.
What are their goals, Dr. Stile? So when they're on the consult, what are their fears? I mean, what are the fears, and also what are the frequently asked questions that you hear on these consults? And we're just about out of time.
Well, the questions are usually, how many procedures do I need? How many of them can I do at one time? How long is this going to take from beginning to end, all the surgeries? And, the investment financially, and as well, what are the risks? Those are all the typical questions that I get.
I mean, you mentioned, Dr. Stile, that safety's high priority for you.
Yeah.
Expand on that.
Anything we do needs to be done right, or it's not worth doing at all. And safety for me is paramount. We have an outstanding facility that's well appointed and equipped. It's probably one of the nicest facilities.
One of the biggest, probably.
Yeah, right. In Las Vegas or in the country. That's a privately run facility, doing this outpatient type of stuff. And, so my patients can expect to be very safe throughout this whole thing, and they are.
Okay, good. Good for you. Very nice guy. Don't you agree? I mean, were you surprised when you met him how down to earth? was?
Definitely.
I'm not trying to make this corny, Dr. Stile, but really. You know?
He's very down to earth. Like I said, he was very understanding of the issues I was going through, the journey I was trying to finish, and I met a good friend besides a great surgeon.
All right, now is he done? Is he a work in progress?
Well, that in the end, that's up to Jay. He's comfortably where he needs to be right now, and as he continues to lose more weight, if things come up, small revisions may or may not be necessary.
Okay. Now, how soon are you going to be in a bathing suit anytime soon? At a pool? Are you doing things like that yet?
I can definitely go to the beach now with my shirt off and not.
Is that right? Okay, good. Is that something you never did?
I did, but I was always kind of worried about people looking at me, of how I would look. Now I'm just the opposite. I want to know how, if I talk to someone, I want to ask them, do I look like I was heavy before?
Well, thank you for coming on the show, Jay.
It's great to meet you.
Sharing your personal story. I'm sure you're going to help a lot of people. Dr. Stile, always a pleasure to have you on. And every time you're here, you're in better and better shape. So
you're my motivation, Randy.
Really, start with a consult. They should go in, visit you, meet with you one-on-one.
Right.
Is that right?
Right, and we'll be glad to help them and address all these questions. They have access to Jay as well through the website.
Okay, good.
And we'll help them any way we can.
All right, thanks. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online, visit our website at wellnesshour.com and just put in Dr. Stile. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.